The outermost layer are the rectus abdominis muscles. Now these are the six-pack muscles. You can see them here. And these are the ones that get really defined when you work out a lot. So you see people who are bodybuilders with really defined muscles. Those are the rectus abdominis muscles. We get these from doing a lot of exercises where we're doing flexion of the spine. Down the center of the rectus abdominis muscles, you see this line of connective tissue. It's called the linea alba, the white line. And the ability to be able to move into a deep state of relaxation quickly is also important, because when you're in labor, you have this short amount of time between contractions. So in the beginning, you'll have longer, 5-7 minutes. As labor begins to progress, you're gonna have less time. You're gonna have 4 minutes, and then 3 minutes, and then 2 minutes in between contractions. So this technique teaches you how to get deep fast. And if you practice it over and over again, you're gonna be able to achieve this relaxation really deeply in a really short period of time. Okay, so let's look first at the pubocervical ligament. This attaches from the cervix. It goes around the bladder. Okay, so the bladder sits in here, and it's going to attach to the pubic symphysis area. Okay, so we can tip this like this, and you can see that's the position of the pubocervical ligament. This pose opens up the top of the pelvis like this. Okay, so when you have external rotation of the femur and the knee is around the level of the hip, the femur is going to be pressing into this part of the pelvis and opening up the top. So that's really great if the baby's head down, right? So if the baby's in a head down position and we are making a practice of opening up this top of the pelvis, we're giving the baby a lot of space to find a good position to start heading down into the pelvis. And we're creating a lot of space there. And we're going to need that when the baby descends even more. From here, we're going to start by first spinning the foot, and then walk the hands over. Walk the heel over. And then you can bring hand to thigh and move in to your warrior two. The cervix is the lower third part of the uterus. So if this balloon is the uterus, this bottom part right here is the cervix. Okay? And you can see here is a picture of the uterus. You have the fallopian tubes and ovaries here. You have the uterus here, and the very bottom is the cervix. Now you're just seeing the tip of the cervix here. Right here, down below the cervix, is the vagina. So the cervix opens up into the vagina. And here's another picture, a little bit closer up. And I want you to feel the breath right under your hand. So feel your hand moving up and down with your breath. Good. Now, a lot of people breathe up in their chest, and they keep the area of their abdomen really still when they're breathing. And we want that breath to go down deep so you can feel where the pelvic floor is. So now I'm going to have her bring her hand down a little bit lower. And just feel the breath coming down a little lower so it's not in your chest. Beautiful. So you can feel the breath under your hand. Nice. As well. And place the heels on the towel, toes on the floor, and you've got a much more comfortable way to do a squat for people who have less flexibility in the ankles. So you always want to make sure that there is enough space for the belly and that it's a comfortable position. So starting with the feet, elevate the heels if necessary. And then the next thing is where the hips are. We want to make sure to do a squat that the hips are above that the knees are above the hips. And I like to use visualizations when I'm teaching this or leading people through the goddess. I'll have them notice how good it feels to be strong. Notice how you can breathe into your heart space, and you can have strength and you can have an open heart at the same time. Now we're going to change gears a little bit. We have been talking all about anatomy and yoga poses for pregnant women. In this video, we're going to be focusing on sensation. All right, if I were to ask the average person on the street to tell me, what's the first word that comes to your mind when I say the word childbirth? Most people are going to say one word: pain. Movies, TV, other women in your lives are constantly reinforcing the idea that childbirth is the most painful thing we will ever experience. It's something that you just have to suffer through as a woman. But I can tell you, from spending over 10,000 hours talking women through labor, that it doesn't have to be that way. She has, let's say there's a big pocket of fluid underneath the baby's head, and my fingers are down here are the cervix, and the water breaks, the baby's head is going to come down onto the cervix, and all of this water will come out as a big gush of water. Either way, if the water breaks with a big gush or the water breaks with a slow leak, she needs to let her healthcare provider know, especially if the woman has not yet reached 37 weeks of her pregnancy, or if the amniotic fluid, the water that comes out, is not clear. So you could also put the wedge under the mat, and that way it's a little bit more stable. If you don't want to use a wedge, you could use a towel. Again, placing them under the mat, if you're going to keep them there for the whole class, is a really good idea. If you are going to just use them a little bit and then take them away, then keeping them on top of the mat might be better. So just a little bit of decrease of flexion you get with this towel, or you can use a bigger towel, thicker towel, and you'll get more of, you'll get less flexion of the wrist. The other thing that you could do that's really common is just to roll up your mat. Let me move my pelvis off my mat and show you that. So you could just roll up the mat like this, and then place the palms on the mat, fingers on the floor. It's actually a little less. So for this, I'm going to stretch it 100%, and then I'm going to go back to about 80 to 90. I'm going to go under her belly. When I get here to under the belly, I'm going to stop right at the midline or just past the midline. And now this rest of it, I'm just going to lay it down. So there's no stretch. Okay, squat down. And then when I lift, I'm going to do it on an exhaled breath. So I'm going to inhale, exhale, and lift. And when I'm exhaling, I want to be hugging my belly into my spine so that I am engaging my transverse abdominal muscles as well as my obliques. So everything's hugging in, protecting my lower back, protecting my abdominal muscles, and then when I lift, I'm going to be in a much safer place. I'm not going to injure my back as easily. Everything is more mobile at this time. So I really need to use my breath for support all the way. And then you can do circles going from around the scar from one hip bone to the other. So I can do a circle like this around the scar. And is that okay? And this way also you can see, is there any part where you're feeling like there's a little like rope under there, or a little sticky part where it feels like there's not as much movement as other places. And so this is really going to be about her doing this on herself and getting in touch with what she's feeling in her own body. Many times you'll have the edges of the scar here, and you'll have like fascial adhesions that come out to the sides that go down. So when we're doing this massaging from hip bone to hip bone around the scar, you're going to feel if there's any of those places. It's really nice to be able to relax when you're doing this and have her have kind of a little reset with her nervous system. So this is a really nice way, but she doesn't have to lean over a ball. If it's not comfortable, you can also do this on the hands and knees. You feel comfortable here? Okay. I'm going to stand behind her now, and I'm going to take the edges of the REBOZO, and I'm going to have my thumbs in back, my fingers in the front. From here, I'm going to bend my knees, and I'm going to lift straight up. And what that does is it takes the weight of the baby off of her spine. So remember, we have the uterosacral and the broad ligaments that attach to the back. And those get stretched when you're leaning forward, just like when we're doing cat-cow or downward dog. And so it's really great to lengthen those ligaments. But if we have them in a stretched state, and then we take the weight of the belly off, and then we begin to jiggle like this, up and down, then we can help to balance out those ligaments. Yoga is also about reconnecting with your body. And if you think about childbirth, it is one of the biggest transitions in life that a woman can have. And it's really difficult sometimes for women to reconnect with their bodies after they have a baby. If you think about it, when a woman's pregnant, she spends all of these months sending love and support to this part of her body. And everyone around her is looking at her and sending love and support to this part of her body, where the baby is growing, where the baby is being nurtured. And so this area of the body gets filled up constantly with love and energy and support. And then she has the baby. And all of that love and attention and energy and support, instead of going here, goes here, the wall. And we have a block between the knees or the thighs, whatever's more comfortable. And then we have her come down into a wall squat, squeezing the block about 40 to 50%. So postnatally, if she's having any pubic bone pain or pelvic girdle pain in general, we only want to squeeze the block maybe 20%, really, really light. In fact, I would say if she's having any discomfort in that area, don't use a block at all. Go ahead and grab that. Instead, use a ball or a rolled up towel. A lot, and that may be working with pregnant women, people are really afraid that what if they say something wrong? What if they don't remember something? And you're not going to remember everything. You can't. But you have the tools now to keep women safe. And if you carry that with you, carry that as your mantra, like, I know I'm going to keep women safe, and I know I'm going to make mistakes, and I'm going to have to say I don't know. In every single training that I teach, I say I don't know at some point. If you are a new yoga teacher, or any yoga teacher actually, you're not going to know the answer to everything. I've been in this field for over 20 years. I'm still learning new things every day. You can't possibly learn everything that you're going to need to know, but you have the tools now to keep them safe. So keep that in your mind, in your heart, and know that, because you're going to be great.
Thank you so much.